Good morning. This is Jake Angelo V. Logan. This is my evidence-based practice proposal presentation for Health 490 Professional Capstone Project. This is my introduction slide. Overweight and obesity in America, implementation of prevention and intervention systems, and an epidemic that's ongoing in America. So unfortunately, America's ability to treat obesity is less than satisfactory, and treatment tends to be costly. Therefore, the development, evaluation, and implementation of cost-effective prevention strategies are of high priority. More recently, refined prevention strategies through the Early Care and Education program have been developed and evaluated. This particular intervention program addressing both diet and physical activity in our children, but can be modified to reduce the risk of obesity in both children and adults. Our problem, obesity, is serious because it is associated with poorer mental health outcomes and reduced quality of life. Obesity is also associated with the leading causes of death in the United States and worldwide, including diabetes, heart disease, stroke, and some types of cancer. The way to accomplishing and keeping up a solid weight isn't transient dietary changes. It's about a way of life incorporating smart dieting, a normal physical movement. A resolution towards this is a health education, physical education, health services, nutrition services, and overall family involvement. To switch the epidemic in obesity, we need to center around supporting good dieting and dynamic living in an assortment of settings. The purpose is to reduce overweight and obesity through knowledge. CDC is showing 40 states have strengthened child care licensing regulations by incorporating a high-impact obesity prevention standards. Also, 10% shows the percentage of U.S. adults are meeting the aerobic physical activity guidelines significantly increased from 44% in 2008 to 54% in 2018, and this can be found in CDC's website. The questions are the PICO questions in my research are: in adult population over the age of 21, how effective are face-to-face nutrition classes compared to virtual classes in controlling overweight and obesity? Between the age of 30 to 45, will they have time to attend the classes compared to adults in the age ranging between 22 to 29 in controlling overweight and obesity? From the ages 18 and up, how many will be interested in the classes controlling overweight and obesity, face-to-face or virtual? With the research model from Early Care and Education, made from children, and results from CDC's research are showing face-to-face are effective with their research. This research can eventually help reduce obesity in America. Obesity is a serious and complex health issue from a combination of causes and individual factors such as behavior and genetics. Behaviors can include physical activity, inactivity, dietary patterns, medication use, and other exposures. The literature review shows an estimated 97 million adults in the United States are overweight or obese, a condition that substantially raises their risk of morbidity from hypertension, dyslipidemia, type 2 diabetes, coronary heart disease, stroke, gallbladder disease, osteoarthritis, sleep apnea, and respiratory problems, and endometrial, breast, prostate, and colon cancers. High body weights are also associated with increases in all causes of mortality. Obese individuals may also suffer from social stigmatization and discrimination. As a major contributor to preventive death in the United States today, overweight and obesity pose a major public health challenge. Also, while there is a agreement between about the health risk of overweight and obesity, there is less agreement about their management. Some have argued against treatment obesity because of the difficulty in maintaining long-term weight loss and of potentially negative consequences of the frequently seen pattern of weight cycling in obese subjects. Others argue that the potential hazards of treatment do not outweigh the known hazards of being obese. The intent of these guidelines is to provide evidence for the effects of treatment on overweight and obesity. The guidelines focus on the role of the primary care practitioner in treating overweight and obesity. Incorporating a model in early care and education. Model. Mine, I didn't do a theory. Mine was incorporating a model. And the idea is to adopt this overweight and obesity children prevention program by implementing it on adults. Centers of Disease Control and Prevention provides funding, training, and technical assistance to various organizations to support overweight and prevent obesity prevention. The CDC has a model in place for children called Early Care and Education. The idea is to adopt this overweight and obesity children prevention program by implementing it on adults. Its goal is to improve the quality of life in reducing obesity and health conditions in adults. The program will consist of nutrition workshops by educating adults. Many of them are parents. These adults are influencers in children's life, who will then make the drastic health choices in their child's diet at home as well. It is a cycle in education with the mindset for adults to initially be educated and to pass on their knowledge to their children, and as they grow on, they will continue to do the same. And proposed solution. The proposed solution incorporates a method of prolonged absolute fasting. This will be undertaken along with parallel supplementation to prevent death from fasting. So I went from the ECE model to going into a fasting method rather than going through the model itself, incorporating that knowledge with the ECE and incorporating fasting with it, with the knowledge of fasting, dieting. Obesity is a national health focus of many countries, where hospitals are treating people for this issue for many decades. Interventions have been designed to counter the problem of obesity. However, there's little evidence available to support the interventions in questions regarding their effectiveness, leading to sustainable change in the behavior and health concerning obesity. This proposal proposes a solution through education that will provide a long-term and sustainable resolution to the problem. The solution incorporates a method of prolonged absolute fasting. Its safety and the expected outcomes based on literature, research, and prior experimentation. This will be undertaken along with parallel supplementation to prevent death from such fasting. The education will also encourage a change of lifestyle and run a public campaign under the hospital's banner which focuses on the positive, practical, and realistic strategies to address their health and well-being rather than focusing on a quick fix. And through the implementation plan, interviewing the patients with provided questionnaires, find a facility and hire staff, and all other logistical resources. The strategy to obtain approval from the organization will be based on two phases. In the initial phase, the obese patients will be provided with questionnaires to interview them in depth about several aspects related to the issue they are facing. The interview score focus will be based on the current interventions and hospital's existing procedures along with the underlying effectiveness. The data will then be assessed to create meaningful outcome and presented to the leadership. Data will present the patient's progress through existing procedures and their opinion on the proposed education. The research paradigm will reflect the focus of a solution instead of existing organizational structure. For this purpose, A panel of experts will conduct regular seminars that will provide an evidence-based discussion on the effectiveness of absolute prolonged fasting, the efficiency of supplements, and the resulting change in lifestyle to sustain the solution for long term. The organizational culture is already familiar with such seminars through expert panels. Therefore, it will not be an obstacle. The change initiation will be the responsibility of a change agent hired through external sources to oversee the entire operation. The panel will be selected from the existing experts currently employed at the organization. Experts from different organizations will also be invited for knowledge sharing. Particular experts on education related to obesity will be hired, and a portion of the budget would be allocated to that as well. For the campaign, the implementation will be done through marketing tools such as adverts and facility awareness boards and posters, a dedicated facility where obesity proposed intervention solutions can be discussed, and facility will be used as a focal point that directs all campaign efforts. Assessment tools will be used as primary resources, including questionnaire surveys, pre-tests, post-tests, and a new individual will also be hired. The cost of the implementation will be divided into 3 phases as well. The cost of the initiation will include the hiring of a change agent from external sources on a fixed annual contract. The salary range is expected to be in the range of $40,000 to $60,000 US dollars. The cost of creating a facility along with its staff will be $100,000. The marketing resources will be allocated $50,000. Staff education in this regard will be allocated a sum of $50,000. Production of educational and related material will be allocated $10,000. Gathering and analysis of the data will include statistical software. The license along with the technology will cost $5,000. Lastly, the change agent will also require a workforce that will aid in the implementation of change. This workforce will also be responsible for the initiation of change, overseeing the entire process from the start will end, and finally evaluating its effectiveness. The workforce will be selected from existing employees on extra bonuses, and the budget for that is allocated to be $50,000. The evaluation staff would be different than the implementation staff. That is because the same staff would present a conflict of interest and might create a bias in the evaluation of the program. And this is the evaluation of the research, weight loss, maintenance of weight loss, benefits of weight loss, and awareness and knowledge. There are several methods through which the evaluation will be carried out, using in-depth qualitative interviews from the selected patients and community participants in the region where the hospital is located. The analysis will be conducted. The data analysis will be used to determine the findings. These findings will be in the form of quotes from the participants, since participants are the most accurate sources of results in this regard. There will be some quotes that do not qualify to be categorized and are entirely unique. However, where quotes follow a certain pattern and a certain way, they will be categorized and presented as a result of analysis and evaluation. The evaluation will be based on a short-term and long-term results. The impact of the public campaign managed under the banner of the hospital will be evaluated in the short term. The variables evaluated in this regard will be number of walk-in patients with obesity issues, the impact of awareness and knowledge spread through the community as directed results of this campaign, the knowledge of awareness community and patients gained as a direct result of the public campaign, the necessary information regarding obesity, its impact on health, and its linkage with additional health issues. Finally, the understanding of the patient regarding the positive impact of change in lifestyle and the underlying steps that can be taken to improve major problematic habits with the largest adverse impact. The long-term evaluation, on the other hand, will be based on experimentation of the proposed education and the underlying methods tested through it. The entire education program is based on a specific set of outcomes, and the evaluation will be made on the basis of those outcomes. The evaluation will begin after a 30-week cycle. During this evaluation, both the primary program, which is absolute fasting, and the supplement's impact will be studied. The supplement will be used to keep potassium and magnesium levels at acceptable levels so that patients do not die of deficiency. The rate of weight will be measured against a loss occurring in the other patients due to surgery. The life history of the patients will also be studied, and the program will be exploring the possible causes of obesity developed in those patients. A specific trend will be established upon which future research will be based. The projected outcomes in this regard would be weight loss, maintenance of weight loss, benefits of weight loss, awareness of knowledge, which are mentioned in the slide. The variable that will be assessed is the weight loss of the patients before the loss and weight after loss. The sustainability and the elasticity of the loss, the extent of the knowledge and awareness determined variable of which is determined through questionnaires. Other variables assessed will be efficiency of the program, the efficiency of the public campaign. The effectiveness variable was determined through a set of questions based on the interviews of the participants. The implication of cost and direct result of the allocated budget on the determinant of success. Determinant of success will be the same as the variables. That ends my presentation. Are there any questions? And these are the references that I have. Thank you. My name is Jake Angelo Ilagan. Concludes my presentation.